Okay, so it's now 6:30 here in Israel, 5:30 in Switzerland, and we can get started. So I want to welcome all of those who joined us in our webinar. And I'm very, very happy and honored to have with me Dr. Vanessa Schumacher from Roche, Dr. Michal Gindi from Asuta, and Dr. Ayelet Axelrod-Balin from Zebra. I'm Chen Sagiv from the Pathology, and the topic of our webinar today is when it comes to artificial intelligence, what can pathology learn from the older sister radiology who has been digitized before? And the way that we are going to do that is that we are going to somehow interview each other. And let's get started. So the first thing is that each of us will quickly introduce ourselves. So maybe Vanessa, maybe you get started.
Sure, so I can introduce myself. I'm Vanessa Schumacher, and I'm leading a group in pharma research and early development in Roche called Digital Pathology and Tissue Technologies. And there we're doing both the wet lab work as well as the imaging and image analysis that's related to focus on preclinical toxicology studies. Should I also talk a little bit about how I arrived to AI in pathology radiology? Okay.
Absolutely.
Yeah, so I arrived to this in a very organic way, I would say. I'm a veterinary pathologist by training. When I first started working in academia about 10 years ago, you would digitize slides just to use as a journal example for publications or for lectures. And then when I joined Roche about 7 years ago, I started progressively getting access to whole slide scans and then starting to do image analysis and then later AI. And basically just arriving to this because you find ways that this can suit your needs for quantifying and being able to compare across projects. So I approach it from a very pragmatic way. I use it to help me get my job done.
Okay, sounds good. Michal, please introduce yourself.
Okay. My journey is a little bit longer. I'm a radiologist, I'm a mammographer, and I've been that for the last 30 years or more. I think AI for radiology is a very natural development, because basically if you look at all the ways the machines themselves are working now, there's a lot of AI behind them. There's a lot of iterative reconstruction, and everything is becoming much more complex, and you need to fully understand how things are being done in order to be an expert. And going into the AI as we understand it now with all the startup companies is actually a way for me to be up to date, to understand what's going on, to know where the profession is going, and to find solutions to various problems and to problems that I didn't know that I had. Because a lot of time the AI is bringing you solutions to problems that you don't even realize that you have. In the last year, I've been in charge also of our pathology because of what has been discussed here, because of the closeness of solutions in radiology and pathology. And I say there's a lot of similarity, but there's a lot of differences. And for the last 2 days, I'm the head of innovation in my organization. So I must have been doing something right, because I think it's the best job you could have nowadays. It's really exciting and yeah. And yeah. So I took the right track. So the short answer is you take the right track and this is what you do.
And you end up with AI. Okay, this sounds very promising. Ayelet?
Okay, hi. So my journey, I guess, is slightly different. Today, I'm the VP Research of Zebra Medical Vision, which is an Israeli company. developing solutions for radiologists. And we have many products already out there, many, I think 6 FDA approved products and additional CE approved products in multiple domains, multiple modalities. I think in a way grew into this field. Both my parents worked in the composition of this domain, and I actually insisted starting my career after studying physics and math to do something that involves human and machine problems, and actually insisted that my PhD would be in this medical imaging domain, where I was the first one in the Weizmann Institute lab to do such a PhD. And then after that, I did a postdoc, which was in Harvard Medical School, and came back to Israel. And there, most of my practice was dealing with pictures, with human machine challenges, most of them in healthcare. And today, this is what I love. I think that it's fascinating to do, to bring these fields together, bring these talents together, bring this knowledge together. And I really enjoy what I do, like Michal said.
So I will quickly also introduce myself. So, and I can really relate to the journey that you have been going through, Ayelet, because also So I'm Chen. I'm co-founder and co-CEO of Deep Pathology, a company, an Israeli-based company that deals with the AI for pathology. And I think I started also. I studied physics and mathematics, and then medical physics, and where I fell in love with computer vision and image processing. And then I did my PhD in applied mathematics. But I think that deep down, I always had a thing for doing something in the medical field, because it gives me some kind of bringing the mathematics to where it can contribute the most. And so I'm already, I have also founded another company 12 years ago, so GiftTech, but in the last 2 years, we are dealing a lot with bringing products to pathology. And I think it's a lot of fun. And yeah, so it's a good starting point, because it seems that we are all having fun. So, so this is very good. So now we are going to interview each other. So the hint is very simple. The person on the left is asking the question, the person on the right, and then there is a discussion. And so Ayelet, you are the first interviewer.
Yes, so Michal, I would really want to know why, from your perspective, AI is needed in radiology. It's not only our invention, but perhaps where and why you think it is needed.
So I think the presumption that AI is needed is not an obvious one. However, the age of solutions for this problem is actually quite old. The first CAD was already there when I started to do medicine, which is a good 30 years ago. So it seems that people were trying to find ways to help radiologists to have less mistakes already a long time ago. And the reasons for that is that we do make mistakes. And the mistakes that we do, some of which we realize that we did and some of which we don't. So the first obvious need was as another reader. And there are lots of fields where it's customary to have 2 readers, and it's very expensive. There's not enough radiologists. So one issue is just helping you to know what you need to see and what you haven't seen. Especially this is true because there's a lack of radiologists all over the world. And you simply don't have enough, and it's expensive to have 2 radiologists for everything. So there are really good reasons to try and make your work more concise, and have some help. I think nowadays we need AI for lots of other reasons, because a lot of things can be seen which we can't see. And once you realize that the vision that the computer sees is different to yours, and it could see things that you don't know that you could see, then it opens a whole new rump of solutions. For example, there are several AI solutions that are dealing with calcium in the heart. So we know about it, and we have special studies that are dealing with it. But the solutions, the ones that are out there, they could actually check it for you without you even knowing that you need to check it. And they could tell you, this guy has some calcium. Now, we could also see it probably, but we don't look at it normally. So, and that's actually one of the very young ones, young solutions, obvious solutions. And there are lots of things that are less obvious and that are much more exciting. So in the end, to get all the information that is there in the images, we are not able to do that. We're not able to do it because some of it we don't see. We're not able to do it because we have another task sometimes, and we are busy with the task that we have, and we don't look at things that we don't need to look for that task. And the AI could give you a whole new rump of answers on the same question or on the same image. There's just one more thing that I want to add, which I'll go more into it when we discuss the differences between radiology and pathology. We should all pay attention to the fact that radiology, unlike pathology, is not only looked at by radiologists. There are lots of other doctors that are looking at films and CTs and MRI, and they are not radiologists. So the solutions that are there, they need to cater for other people, other professions, because it's not going to change. And that is another whole new aspect of what AI could do. Okay.
Okay. I like this. The interview, you can also conclude if you like, or add your perspective, or we can go on to the next question.
I think it was a wonderful answer. I think, you know, also not only the perspective a long time and the perspective across professions is something that that I think is really, really important to us practicing AI to understand. And so thank you.
Okay, cool. So now I'm going to bring the same question, but not, so why, Vanessa, why is AI needed in pathology?
So yeah, I can only echo what Michael has already said, that there's a huge opportunity for the application of AI also in pathology. In pathology, we look at the increased need for precision diagnostics, and we have this convergence of the different revolutions in medicine, if you will. So we have right now a lot of molecular data, like genomics data, proteomics, that we can combine, as well as with electronic medical records in the medical profession, and then these access to these whole slide images from the whole slide image scanners, which hold so much information. So I think this convergence enables us, and actually this requires the use of AI to really integrate this and put it all together, and to use all of this very complex data and try to distill some patterns out of it that we can understand and attribute some relevance to. Maybe I can say a few words about my specific field, which is toxicologic pathology, and where I see a huge opportunity for AI to really revolutionize this field. Because in ToxPath, we as comparative pathologists are evaluating a large number of slides from many different organs, and we're basically looking for almost like the needle in a haystack. So the majority of the slides in the study are going to be normal, healthy tissues. And we're actually searching for and want to focus our time on finding those tissues that have abnormalities, because those are the ones that are going to give us insights as to what could be potential mechanisms of toxicity of our compounds, what could be potential doses or organs, of course, target organs of toxicity. So I think this is a huge opportunity to streamline our workflow and also to focus our evaluations. As Micha said, the computer-aided diagnostics is a huge component that I think brings a lot of added value and helps us to have more precision and also focus on the right things when we're doing our jobs. So I think these are the key big areas. I think there's a lot of opportunities for AI to be used as a helper for us in pathology. Those are the areas where AI has already shown a lot of added value. So the things I'm thinking about are automated annotations. Anyone that's a pathologist on the call knows that annotating images pixel-wise can be a very cumbersome process, and it's not that much fun. Things like annotation, it takes a lot of time, and it's really not scalable if you're having pathologists do these annotations, on an individual slide basis. So if you could train AI algorithms to do these annotations and to take over that work for you, and you sort of oversee this whole process, this could also lead to a huge jump in efficiency for us. So I think for pathology, there's a lot of potential use cases. There's sort of the big transformations we could look into, like integrating genomic data with pathology data, but there's also some very down-to-earth, very basic things. Like if a pathologist were to say, what is the aspect of my job which is very repetitive, takes me a lot of time, maybe I'm not as precise as a computer also, cell counting and things like that. So I think those are the first opportunities we should look and see, can we use AI to help support us in those goals?
Okay, that's great. And well, I'm very glad to hear your view, and completely agree with that. And so Vanessa, now it's your time to, and this is really to try to see from the experience of radiology, to try to understand how things happened actually.
Yeah, so exactly. So from my side, I see the transformation. We're living this in pathology now, and we're seeing the early benefits, and we're dreaming about the long-term benefits that we can see. So my question to Michael is, any transformation maybe takes some time to gain momentum and to start delivering on the value that's promised. And I'm just curious, could you share with us what were the main challenges in the acceptance of using AI in radiology? And as on the slide, was there a killer app that made a wow effect that led you as radiologists to say, we actually can't do our work without AI because this is actually required to have a higher precision?
So I think generally speaking, we're not there yet in radiology. And if somebody would say to me, who's going to make it first, radiology or pathology? I'm not sure I would say radiology. And there are lots of reasons for that. I think generally speaking, because radiology became digital much earlier than pathology, and there are two different revolutions, the one that we came digital and now the one that needs to incorporate AI into that. This actually made life a little bit more complex. There's a lot of fear among radiologists as to what is the future going to look like, and would they have a job? How is it going to be? Is it going to be a substitute in the beginning? Like 5 years ago, you would find crowds of radiologists saying, don't cooperate, don't help, don't teach the machine, because then the machine is going to take it over from us. And in fact, I would even say that I don't think it was actually fully matured, this discussion. It's just that the facts were going forward, and in the end, you need to join the crowd. But a lot of people are still worried about it. And in fact, I do think that the profession will need to change. And also the profile of people that are going to this profession would need to change, because a lot of things that are being done by radiologists, and for that matter by pathologists, that we called no patient care profession, the ones that are, sitting in the back, don't meet the patient, don't get involved with patients. A lot of those tasks, machine might be able to do. And the part that is definitely looking like would need or would take time or would need doctors in the end is the more holistic part, is the more, the part that actually asks you to take a few things and put them all together, to explain something to either your colleague or to a patient. And a lot of radiologists are not that keen about this part of their job. So that made it really not easy. I think, I remember that in the RSNA about 2-3 years ago, a guy was standing there, you know, talking about the future and where is it all taking us. And he basically said, you know, people are thinking this is going to take 5 years, but I'm telling you it's going to take 20 years. And maybe that is also part of the story. And that is also why it still continues. Because in the end, when we look at an X-ray, at the chest X-ray, there is no app that is actually taking care of all the tasks that we are supposed to be doing, that tells you about all the nodules, whether they are suspicious or not, about all, you know, about PE, if there is one or there isn't, about all the tubes, where they are, did they move, is there a, you know, there are lots of tasks that we're doing, and we don't even give ourselves an account on what we're looking at. There is, you know, there's a lot of discussion how radiology looks at the film, but it's not that simple. And there's a lot of intuitive kind of way of looking at things. So in the end, I would think the challenge was that people were scared. And I think it is still part of what needs to be taken care of. And was there a killer application? Difficult to answer. I think there were several. I think there still would be another one that would be the killer one. We haven't seen it yet. I think on the whole, people were quick to adapt the application that gave you a hint that something very serious is going on in a film, because people want to not miss a dangerous condition. So the app that is dealing with that, that is enabling you to know if there is something that is life-threatening, is very quickly adapted in a lot of places, even though it doesn't give you a whole answer to what is in the film. It's also, if we go to my first point, it's also an app that still leaves the role in the hands of the doctors, because it doesn't say everything about the film. It just tells you, this is a film you need to look at right now because there's something there that is dangerous. And I think this app is very popular, partly also because of that, because it's very clear in this app that the doctor still has a role. Whereas in some others, it's just a matter of time where the app is going to be better than the doctors. And, being a mammographer, reading mammography, I'm not sure that we'd have a role in 10 years' time in it. I really am not sure. My mother used to work in a lab. She used to look at slides of blood count. She used to count the number of white blood cells, various kinds. Nobody does that anymore. There's a machine that does it, and that's it. And I'm sure there would be things that we won't be doing anymore. That's absolutely, that's the future.
Could I ask you a follow-on question to that? Yeah. Because in pathology, it's, and I think it's the same with any transformational technology, we have these sort of different groupings of people. You have the very early adopters that are super enthusiastic. You have the skeptics, and then you have the people that are really resistant. Yeah. And
I think age is the first variable that you need to look at. Age. I'll be sexist for a minute because we are all women here in the panel. Have you noticed that? So yeah. I think women are better. Also in this, they're more flexible and more sensible in that sense. And I think the more savvy you are, generally speaking, the easier it is for you to adapt the tools, and the more potential you think. And on the whole, people that are involved in developing it are the ones that are going to push it forward. So people like you and like me, and there aren't any other doctors here, but people that are involved in testing it. Although they see all the problems, they are the first one to adapt it.
I'm wondering, Vanessa, reflecting to what Michal was saying, do you see similar fear or concern on pathology side of accepting of, oh my God, this AI is going to replace me, and what am I going to do?
So my personal experience from the discussions I've had with other pathologists is actually that this is a lot of hype in the popular literature, first of all, and a little bit in some of the journal articles that have been written, that there's this fear of the pathologist. But actually, most of the people that I discuss are not really, they're not fearful that they're going to lose their job, that their job is going to be taken over, because they know that what they do and what value they bring to their projects, to their patients, is not just counting cells or not finding the lesion necessarily, but all those things around it that Micha mentioned, all those sort of intuitive things and all of this. And I think really the resistance comes from, and I think we plan to come to it later, from, you know, putting some of the interpretability of our topics into the hands of a computer. And how do we trust that? And how can we validate that and make sure that, of course, the worst case scenario, that this would perform incorrectly and make incorrect decisions, and then in the end, who's responsible for this? What impact does it have on patients? So I think the skepticism and resistance comes a little bit more from there, and also from the point that there's still a lot of potential value that hasn't yet been fully realized. So it's just to start gathering the data and seeing the applications. And I think this information is coming in, and there's been a lot of huge strides just in the last 2 years of seeing these applications at work. But I think it's less a fear of losing the job, but more the fear that it's not going to perform as well as we would wish.
Yeah.
I think, you know,
actually, so I'm sorry.
Can I say just one sentence?
Sure, absolutely.
When I interviewed my pathologist in the department that I have, and I've interviewed about 60 of them, so it's not a few, it's quite a long. A lot of them were saying about the need for them to actually feel the glass or work in the computer. You know, they were using all kinds of words, which I don't even know how to repeat. But the whole environment of how they work is going to change dramatically. Not to mention the location of where they're sitting and a lot of other things. That it's a real revolution as far as the pathologists are involved. And because AI is coming together with the digital revolution, I think a lot of things rub on each other. So a lot of things that have to do with being digital is moving, you know, is influencing how people are accepting AI in pathology and vice versa.
Okay, so we will move to the next question. So it's like, I think, a follow-up question to what we discussed now. And so I'm asking both of you, Michal and Vanessa, what would you expect from an AI system, or to keep let's say the discussion very focused? What is the most important thing that you would expect from an AI system? So maybe Vanessa, you can start.
So to have the most important thing, the bottom line, I would need a system that I could trust and that would increase my diagnostic confidence, decision-making confidence, and it will increase my efficiency. So just some small wishes from the AI system from my side. Okay,
and Michal, what do you say?
I would want it not to waste my time. So a lot of time, you know, in the early solutions, you would get, let's say, the application would tell you where things are suspicious, and some of which you've already seen, or it's a waste of time. So a lot of time, there's just a limit into how many times when you work, you want the computer to disturb you. And it shouldn't be more than 5-7 times in an hour. That's the most. It's been studied. So you need to be there when it's needed, and you need to not bother somebody when it's not needed. So in that sense, if there is an app that is telling you where you're wrong, and it tells you you're wrong on every study, and a lot of that is wrong or not accurate or just more, I don't know, then it won't help you. So it needs to take you into account.
Yeah. Okay, this is this is good. So we don't want the computers to waste our time, and we want them to help us and not bother us. It's a good thing to hear. And now, Michal, you are the one to ask questions. So maybe you can ask Ayelet first.
Yeah. So Ayelet, do you think data is the next oil? I don't know what happens to the oil. It doesn't look so promising, but is data the next oil in your opinion? Ayelet, you are mute. You are mute.
So I think that data is indeed an oil, definitely. But actually it's not, so data itself is useless, however, if it's not managed properly. And I mean, it cannot come, so you can have a huge amount of data, but if you do not have smart definitions of the problem, as you said, Michal, these problems are complex. They're not simple. Most of them some of them are simple, but you know, as you get further on, some of them become complex, and the definitions of the problem are extremely important. The selection of the problems is extremely important. Also smart representation of this data. So if you have, for example, you know, multiple images covering a certain aspect of a problem, or 3D representation compared to 2D representation, all this information is extremely important. So the data itself is not enough. And also, to connect to what Vanessa said, it has to be accompanied with high standards of work. So in order for us to trust it, it's not enough for us to say, okay, we trained on such and such amount of data. It's important how you validate yourself. It's important how you combine the knowledge of experts inside your system, what they want to see, what they don't want to see. So I think it's you need the data, of course, and it's going to be extremely important, but you also need to know how to use it properly and to extract out of it the important information.
Okay, so my picture is there. So I will also relate to this question. I think that I completely agree with what Ayelet said, and I also want to add maybe just another angle to it. I think that for many use cases, you actually don't have so much data, and still this data is very valuable and should be used in to gain new insights, information, and tools. So I also think that it is great to have a lot of data. It is great. It is very important to validate, to define the problem correctly, and to have diversified data that actually represents the entire problem. But I think also when you don't have so much data, and you still need to extract this information. So like I know that in some domains there are the pathologists who are experts in this specific type of things because you don't see it so much. And I think one of the challenges from my point of view is also to be able to assist bringing new insights and bringing some, let's say, help assisting pathologists also for use cases which are a little bit more rare, so that usually pathologists will not see them so frequently as other things. And sometimes you don't have so much data. And one of the challenges is, the way I see it, is to really to extract the oil, even when the foundation is very, very a small amount of data. So just to add to what Ayelet was saying. And we are going now to the next question.
Yeah, so this is one that is really interesting for me because we know when radiology went digital, there was a huge case for that because, of course, you can then skip producing the film. What about the pathology slide? So do you see that we're in the direction, and what are the steps maybe we've taken toward a slide-free pathology? And do you think slide-free pathology is something that we can achieve? Or is this just a fantasy?
So first of all, there's, I don't know in which episode it is, but in one of the Grey's Anatomy's episode, there is the pathology pen. So, I think it's not a fantasy. I think this is something that probably will happen at some point, but definitely I think when so going digital, only going digital for radiology was already a huge let's say money saver and the excellent, let's say, excuse to do that. Whereas in pathology, you still have to prepare the slide, you still have to put all this work, and now you have to buy the scanner, and so you have, before you save any money, you need to invest a lot of money, so it costs you more to just get started. And therefore, I think that the extra benefit of becoming digital, so to provide sophisticated AI tools, are really a very, very important claim when you want to say why it is important to also do this digitation process for pathology, which doesn't give you, well, now I think with COVID, becoming digital and being able to view things from afar is, so COVID, which is terrible, at least it made a point that becoming digital is indeed important. How will we see a scenario where you actually can escape the entire preparation, the cutting and the staining? I think that maybe it will be interesting to find a first use case to think about it, maybe during surgery when you want to actually, keep to clean and to make sure that you took out everything that you should. But I think that we still, I don't know, I think it is still not something that we see. And I want to bring back the question to you, Vanessa. What do you think? Do you think that this is something that we can expect to see in the coming years?
Yeah, I think it's definitely coming, and it's been demonstrated, at least proof of concept, that we can, for example, use, it was demonstrated at this year's Pathology Visions, using just unstained slides and training networks to be able to reproduce what this would look like as an H&E work that virtualizes IHC staining from H&E or from immunofluorescence to H&E, so back and forth. I think those are already the steps to really bring a lot of benefit to us. What can we do with the typical H&E slide or even unstained slides, which we may have in our archives? So that really will unlock the potential of our slide archives, what we already have produced and what we can use. I think that will be very transformative as we start to explore those topics. As far as slide free, there are approaches that exist as well. I haven't been aware of any that are put into production, but I think that there's, for certainly in medical field, in surgery, there's applications. There's also potential applications of looking at beyond the whole slide image into 3 dimensions, and also non-destructive imaging techniques. I think there's going to be more opportunity for those technologies in the future, but slide-free pathology is something that I think, I agree with you. I think somebody could come up with a solution for that, but I haven't seen it yet.
Yeah, and it's fascinating. I think that and virtual staining, I think that the saving on the amount of stainings is really cool. And I think, as you said, it's already been demonstrated, and I think it holds quite a lot of promise. So going back to radiology. So Michal, please. You are on mute.
So basically, I've already discussed it before, but the fact that radiology became digital before AI revolution was there, and pathology is becoming digital more or less at the same time, or maybe even after AI solutions are there. What do you think? What kind of difference does it make on all the adaption and the way the future of both those apps?
So I think that actually this gives pathology a big advantage because first of all, I think that in terms of the technology, it has matured in this last decade significantly. I think that there's been a tremendous progress in many computer vision tasks. It's a very popular field. Many researchers, not only in medicine, contribute, to new architectures that can be used, classification, segmentation, detection, all these problems. Computer vision people, we say they work. You can show that they work. Now, so I think that the entering of pathology to this at this time is good, also in terms of compute, also in terms of efficiency of these of ability to apply this technology on big images on multiple domains of data. So first of all, in terms of the methodology and the technology and the infrastructure. Second is also many issues that we have accounted throughout this, last decade, and the experience with intra-rater variability, the different opinions of radiologists, the annotation issue that you mentioned, the ability to automate it, or the understanding that you need to automate it, and that it's just not scalable to annotate so much data for the needs of what you need. So how do you deal with this? The issues of interpretability, understanding of what these models do. So all these issues are an additional dimension. A third dimension is the business issue. It's been taking a radiology and AI algorithms a while to enter this field. I think there is a lot of understanding of the difference between an algorithm that can be developed in the university or the lab and between a solution that really needs to work in practice in the field, and what does it take, and what sort of team does it take, and what sort of work it takes in order to bring this an algorithm to be a product, to be a real solution. And I think that all these insights will be, it's going to be low-hanging fruit for pathology to just read this, understand this, learn this also the importance of the collaborative work of experts and algorithmic people. All these insights, and I think that pathology, looking at success cases of radiology, can also be a little bit less skeptic and understand that some problems will be maybe more difficult, but some problems can be solved and can be applied. And I think all this comes in an advantage to pathologists coming into this era. And I hope that radiology will still beat pathology, or I don't know, but I'm sure that both fields will gain a lot of profit from this development and collaboration.
Yeah. Okay. That's cool. And now I get it. Now it's your time to ask a very, I think, tough question. And
so I think you both talked a lot about trust, and really it's important for me personally to understand what makes an AI algorithm, system, solution worth your trust. What would be needed? Vanessa, maybe you would like to start.
So for sure, what I trust is something that I can understand. So some level of explainability to me on how the algorithm is making decisions. And I think there's approaches out there that can be very intuitive for pathologists to have a look at. I'm thinking like GradCam or something like this, so we can understand how is an algorithm making a decision. Could this just be noise or artifacts? Is the algorithm just detecting the red dot that the oncologist is putting on the slides when they find a tumor? So I think those are the sort of things that would be the first step. And of course, then just the very practical aspects, it has to be just like any other assay we would use. It has to be repeatable and, you know, demonstrated precision and accuracy, what we would expect. So I think for me, those would be the sort of key components of trust in an algorithm or an AI approach in general.
Okay, and Michal, what do you think?
I think radiologists on the whole are using machine all the time. So we trust machines, basically speaking. All the images that we see, they've all gone through some kind of augmentation with, you know, various algorithm that we don't call AI, but it's the same kind of thinking. I would say that explainability is good, but in fact, it's not that necessary because I would give you an example. I was in a meeting, in a really huge meeting somewhere, and another company that is not presented here showed the way they analyze retina. And they said they could tell you if it's a male or a female, and they know for sure. And they have 99.99999% accuracy. And, you know, some women are actually men, so it could be even be that they have a higher accuracy. And, you know, they have actually showed us what are the spots in the eye that are contributing to this understanding, but we don't see that. So in the end, I think after a while, you realize that AI will see things that you don't see and will give you information that maybe we won't fully understand how it reached. I think it takes maturity. It's not the first thing that I would do. I wouldn't start with giving me something that AI can do that I can't understand at all. But I think in the future, there will be things that we will not be able to understand and we will accept them. But they need to be accurate. They need to let you know how accurate they are. So if something is not, you know, is only 85% true or 95 or whatever, we need to know that. And the task that the doctor has to do with this information should be clear to the doctor. So is he expected to decide, or if there's no need for the doctor to get involved, maybe we don't want him there. I don't know. I'm just saying explainability, and I know there's a separate question for that, so maybe I'm going there as well. I think it's very nice, but it's not going to happen all the time. It just won't. And if we go into radionomics, which is genetics and radiology, we won't be able to understand it. It's a dream. We don't.
But would you be able to, so maybe I'm also going into the next question a little bit, but
Sure.
but would you be able to believe a system that just gives you, you know, it's not a card, it just says, I don't know, malignant, non-malignant.
I would need to play with it for a while and make sure that I see it. I think both radiology and pathology had the understanding in the medical field that they are the grand truths. We know now that it isn't true because a lot of time we have a pathological, definition of a disease, and then somebody is behaving differently. And then in the end, we realize, oh, it wasn't that, it is something else. We know that nothing is sure. And we need to change the way we think about things. We need to. And I think medical professions are accepting it. It's going to take time. And of course, if you understand the process, it's much better than if you don't. And of course, if you understand it, it also helps you to know where to get involved. And there's lots of reasons why we want to understand. And we want to know what is the basis of a decision or what's the process, and a lot of things that are important in this area. I'm just saying that the trust, I'm not sure that it comes from that. I'm saying trust is something beyond that. You should know the machine in order to trust it. You should know the people that are, you know, what's been there, in how did they come to this conclusion, rather than explaining the very way this solution is seeing whatever it's seeing.
I think that Vanessa wanted to comment on that. Did you want to comment on that,
No,
Vanessa?
I definitely agree with you, Michal, also that there's a huge opportunity as well in these non-explainable features. So first we have to figure out, is this a real subvisual feature or is it just an artifact? But then digging into that and trying to understand what biological relevance these subvisual to pathologists at least features might have, I think could be a very exciting field of research as well. So I agree with you there. I think, and I also agree with you that such an approach that couldn't really be explainable to me would also take me a little while to arrive at some trust in such an approach.
Okay, so actually this brings us very naturally to also the next question. Yeah.
Yeah, so I'll flip the coin then and ask the experts in the computational side, what about explainability? Is this something you see from the business side as a requirement, and is this something real that you think is needed, or is this a nice buzzword that we put in to make ourselves feel better about AI approaches?
Ayelet, please go ahead.
So I don't think it's a buzzword. Actually, we take this very seriously, and we see, at least during development, we are always interested in looking and trying to understand what it is. You know, are there any systematic issues that we should be aware of? So a lot of investment into this visualization, localization, and I think that, and our feeling is actually that this is indeed needed to build this trust and relationship in the field, and this is why we are also investing in it. So not only to give a like global answer, but also to be able to localize it and identify where exactly the findings that we see are. And there are various, and this is like a huge, I assume you know, it's a huge domain of research. And there are many algorithms and a lot of progress, and it's really something that we you know, make sure that we follow and track and include in our solutions.
I wonder if it is the need of you so that you could trust it, or do you think that we needed it so that we can trust it?
I think
it's also part of the way you think about things.
I think that the process that you described that you are going through as radiologists, we had to go through as you know, researchers, because when I entered the field, we used to handcraft the features. And we used to say, okay, this is a tiger because it has this and this texture. And this is a multiple sclerosis lesion because its gradient to the borders is like this and this. And now we don't do this anymore. We just need to rely on the machine. We need to make sure that the data we ingest is properly represented, not only on how it is built, but how it represents the population, and to make sure that we validate ourselves well enough. And a data-driven approach is what makes me believe the team's work, solution, whatever we develop under our hand is good enough. First of all, but also I usually, you know, me and the entire team of clinical radiologists working with us wants to see to make sure that the findings that we find and whatever we say is positive is indeed positive, what we say is negative. So we have like a sort of validation methodology to make sure that what we produce, we can believe in it. Localization and explainability is one aspect of it. So
actually the discussion is too interesting, and I'm watching the clock, so I just want to add about explainability, and we also get some questions from the audience, so I want to take the last 5 minutes for two things. We just had last week a very big conference here in Israel, the IMVC, and we had the opportunity to hear from some thought leaders in AI. What do they think AI should go in the next decade? And they definitely said that understanding AI, us researchers, to really understand things more thoroughly, more mathematically, more systematically, is a challenge for us. And I think that, as you said, Michal, we have to understand, you have to understand, and all of us have to gain trust. And I want to now to go to our last question. So I'm not sure that we okay, actually we are on time. That's good. So questions from the audience, and there were a lot of them. So I will be happy if you share with us, all of you, what is the next big thing to expect in the coming years, either in radiology or pathology, and also if you can relate to one of the questions that were asked about having an holistic approach. So not only pathology, radiology, but genomics, but having something which is more holistic. So I don't know, maybe Michal, you want to start?
Yeah, so I think a holistic approach is actually what I think where things are going. You know, a lot of people are speaking about the 5V or the 4V of big data, and variety is definitely one of them. So yeah, you know, I think basically, I think establishing the ground truths in a different way is going to be a lot of what we're going to be looking at. This would affect medicine in many ways, because we are used to walk in one path, looking at one result, doing one thing, more or less, trying to see which path. There are lots of options, but once we are doing things, we want to have something definite, and it's going to be all statistic. It's going to be hard. But this is where I think it's going. I think, you know, when you talk about big data and you say that the first one is descriptive, then you go to diagnostic, then you go to prediction, and then you go to prescription. So I don't know if we'll reach prescription that fast, but basically this is how we should go. We should try to predict things more, to make more diagnosis. And in that sense, this is another reason why I think pathology might beat us. Because unlike radiology, pathology is actually always ending with a diagnosis. They always give you, they tell you what they think they're looking at. They might give you 2, they might give you 1, but they need to actually commit to something in the end. Whereas radiologist reports, at least in the past, were very descriptive. And you could end a radiology report without saying what you think it is. Nobody would tell you you haven't done your job. It could be a whole description of what you've seen, and you're not committed. Now you do more than you did before, but you're still not committed to say what it is that you're looking at. This is not the way pathology has been growing. Pathologists, they commit. And in that sense, I think this is going to be a big revolution also for radiology and for pathology. And data from the clinical, from the EMR, and from genetics, and from other things that we don't think about, and from our teeth, from our environment, lots of data that we are now not looking at are all going to be eventually included.
So we are reaching the top of the hour. So Vanessa and Ayelet, if you can also tell us shortly. So Vanessa, maybe you can start. What is the next big thing in your opinion?
You are on mute.
Vanessa?
Yes, sorry, I'm turning off my internet because it's very unstable.
Okay, great. So the next big thing, Vanessa? Or you? Okay. So yeah, let's the next big thing from your side, and I hope Vanessa can rejoin.
So I'll just say shortly, I think that I agree with the question asked and with Michal. Indeed, I see the next big thing is looking at the human as a whole, the full story, a multidisciplinary story with the text and with the genomics and with the images and with the pathology images. And I think composing all of this together will be our next thing to bring to healthcare. So I really agree with this.
Okay,
With this
Vanessa, can you? Okay, so
Yes, I'll try. So to connect to one of the questions I saw in the chat is, you know, a lot of these, especially the integrative assessments of AI with digital pathology with genomic data sets. This has been done on very clean data that's been sort of curated to achieve this purpose. I think the next big thing will be seeing how does this apply in the real world, and to really understand, can we really scale this to be applicable in real world scenarios, or will we have to indeed handcraft to depending on our data set? So I think the next big thing is just to see how these integrative approaches will deliver.
Yeah. Okay, so actually we have to leave, although the discussion is really interesting, and I want to well, it could, and we have some questions. So first I want to tell the audience, we will collect the questions and I will distribute it, and we'll get back to you with the answers. Thank you. It's a huge topic. Here are the contact details, so you can also get to us afterwards and ask questions directly. I really want to thank Michal and Ayelet and Vanessa for this discussion and for taking the time and having this panel. You made me feel like I'm in a very you know, fantastic and futuristic and fields. And I think that radiology and pathology will go hand by hand and win together. So hopefully with this optimistic message, I want to thank everybody who's joined us, and thank you. Have a nice evening or morning, depending where you are. Bye-bye. Thank you.
Thank you. Goodbye.
Bye. Bye.